Hello everyone on Thursday. I'm sorry that I can't join you. I have been listed for some time for carpal tunnel surgery and I got notice just a couple of days ago that it's scheduled for Thursday. Having reassured Colleen that I was fine for Thursday, it's now important and necessary for me to pre-record this as best I can from home. Firstly, I want to acknowledge the traditional owners who have cared for over many centuries the land that has kept me sane over the last 9 months. I also want to acknowledge South Australian members and participants of DANA and to this seminar and forum, since I know as a Melburnian what it is like to be going through your own experience of anxiety, uncertainty, confusion, distrust, distress, and need for just hanging in there. We wish you well. My own perspective as I participate today is that I have the honour and the privilege of being invited to become DANA's first patron in 2013. I fortunately was joined last year in 2019 by another patron and a nurse this time, Tanina Harvey. So welcome, Tanina, and I'm sorry that I can't be participating directly today. And I say that especially since I am not a nurse. My background is in social work, in psychology, in public health. I have worked for many years in the alcohol and drug sector, initially in late 1969, and really ever since then, one way or another, as a clinician, as a teacher, as a lecturer, as a researcher, a program developer, policy advocate, policy developer, advisor, at various levels and across various organisations. And so it is with that perspective that I congratulate DANA on this report that I have the privilege of launching today, a report on the drug and alcohol nursing sector workforce at 2020, from the research that was done in 2018 predominantly, and I'm impressed with the way that research was done. A mix of the literature review, consideration and screening and looking at advertisements for nurses with alcohol and drug emphasis across a long period. Especially impressed that this is both Australia and New Zealand that have been included. The survey that was done, and then I think about 40 interviews to ensure that there was a good qualitative understanding of those quantitative survey results. The report is presented very clearly, helps me that it has graphics, it has pie charts, it has graphs, it has maps of Australia which show that there are people who identify as primarily alcohol and drug or drug and alcohol nurses right across the territory that has been surveyed. So across all jurisdictions and across New Zealand. Of course, there are fewer in regional and remote locations, and obviously the survey has very few people from those locations who were able to participate, but it is nevertheless an impressive, comprehensive, thorough, scientific report of good research. Well done, DANA. In launching this report, I have read much of the full report, but I admit not every word of it. I have read every word of the executive summary, and I understand both will be available on the DANA website. I found the report a reminder of many things and a prompt for a call to action in its own way. So I just want to make a few comments along the way, not summarise the whole report. The executive summary does that very well, quite briefly and very clearly. I want to just highlight the few points in the findings and recommendations that stood out for for me. One of them is that these nurses across these countries are highly qualified, very experienced, and endangered. Endangered because of the age profile. There are many more in older age groups than there are among the young. And one of the challenges arising from this report is how might we encourage and attract young nurses to join our specialist sector in the range of roles that are now available, not just as inpatient or community-based workers, though that's the predominant one, but even as policy developers and advocates, researchers, and across the practice arenas, both inpatient, outpatient and community, there are many other opportunities, not just in health, increasingly also in justice, in family and communities, family and childcare. Aged services are increasingly needing people with alcohol in particular and drug expertise. So this is an arena of a group of professionals who have much to offer, who are perhaps underutilised and not sufficiently visible to those who are employing people, where we need this sort of expertise that nurses can bring. One of the factors that is raised about the complexity of our sector is the increasing complexity of the clients, consumers or patients, and the need, therefore, increasingly to have nurses fulfilling many of the roles. The mix of medical complexities and complications with mental health ones, with social complexities, together with drug and alcohol use, is increasing in my view, and this report tends to support that. We need nurses in these roles, and there are many opportunities as we move from where I started some many years ago, 50, let's say, when the advice we were giving people as workers with people with very high alcohol use, then called alcoholics, was that you could drink up to 10 drinks a day and be safe, but anything over that was excessive. Can you believe that? That was the advice, and I've still got some old notes of mine in the orientation to my first job in what was then called the Alcoholism Clinic at St Vincent's Hospital, Melbourne, that the number of drinks someone could have would be 10 a day, but no more. So hasn't that changed? But now we even have depot medications for some of the substitute pharmacotherapies. We have a range of physical illnesses and complexities around hepatitis, for example, and other things that we have not had earlier experience of, and the late stage complications of some of the drugs that our consumers or clients or patients have been using. This all increases the importance of having someone who is well across the clinical, medical, scientific, nursing context of knowledge and the skill and capacity and willingness to respond. And speaking of willingness, one of the issues raised in the report is the stigma that seems to stick to some degree to the workers in this sector. I've always been very aware of that as a worker in this sector. And there's many sociological texts written about the way in which we tend to take on the stigma associated with the client population that we work with. All the more reason for us to be clear, to be steady in our knowledge and our skill, and to be willing to advocate and be engaged in policy as well as in practice. What I think of as preparedness is one of these factors. And I look to the undergraduate curricula of nurses, but also of those that I have taught, social work, psychology, medical students and dental students, as well as town planners and a few others. And what I note is how difficult it is to get alcohol and drug curriculum into the undergraduate arena. I'm very aware that this report makes a point about the importance of having more AOD content in the undergraduate years. My experience, particularly of lecturing to medical students, is that it is so important that we take every opportunity to excite, to energise, to encourage puzzlement, and to encourage inquiry, and to encourage reflection among students in relation to alcohol and other drug use. We need to understand that every student, in my experience, has an intrinsic interest in the content and the knowledge of alcohol and drugs, either because they are users themselves, or they know someone who is, or they've watched people who are. And I think in that context, it's not that hard to excite their interest. I found it was better to start on the drugs that most people use, and I often used caffeine to intrigue, to stimulate, to connect dependency or psychoactive effect, and then psychoactive drugs, to the issues around everybody in the lecture theatre or in the classroom. So I think we need to be imaginative and inspire, encourage, and get hold of these young people when they're students in various arenas, and especially nursing. It's also important to take every opportunity. If we're asked to give a lecture, to have a go at imagining it in our own sense, in the way that I've just described, for example, but also to try and see if we can't get on the exam paper. There's nothing like developing up an exam question and having that in sample exams for students to actually study up on AOD. And lecturers or teachers in the arena will usually welcome a good exam question, particularly if it has model answers available. I've found that most helpful, and case studies. And what I called, when I was the curriculum coordinator for alcohol and drugs for medical students for some years, I called it curriculum infiltration. I used to challenge the students with facts from scientific literature. I still recall in one of my lectures saying that I understood that alcohol consumption was one of the factors contributing, although a smallish percentage, to the explanation of breast cancer. I invited them to take that piece of information to their pathology lecturers. They came back and said, the path lecturer said that's not true. So I then met the path lecturer, gave them the articles I'd been reading, and they shifted and changed their lectures on alcohol's contribution to a range of cancers. That's just a little example. Among the recommendations is the importance of engaging nurses in policy, which I've talked about, encouraging and attracting young ones, and I think Adam is going to talk more about how we might go about attracting more people into the alcohol and drug sector. The importance of inclusion in undergraduate years and the opportunities that now exist for alcohol and drug trained nurses who often are more specialised than many others to contribute to a range of areas in healthcare. It's an exciting time. There's much to do. And so I'm so pleased to have the opportunity to launch this report this year. And in doing so, I will just say a word about the things I've noticed about nurses, working with many over many years. I've always found them to be good-humoured and willing to have a go. Willingness is one of the most critical ingredients of being a useful professional. And nurses, in my experience, have usually been number one. As they have been as team players, I've never met a nurse in a context I've worked in who wasn't able to and willing to participate with others, other professionals, other people, and with other clients and consumers, and give things a go together. But most importantly, what nurses bring to this sector is their professionalism, their humour, their care, their science, their understanding and their art. This is an important profession. Let's try and grow it. Let's try and ensure that it goes further. Let's try and make nurses the key professional in alcohol and drug services and infiltrated across a range of other services and opportunities in the community. I wish you well, Dana, with this report. Well done and go well. Bye.